in cancer therapies, I've been working cancer therapies for over 28 years, and nutrition is a key component of what everyone, not only with cancer, but anyone that's in remission. And the doctor told them, you know, you're okay, go home, and let's come back in 6 months to check and see how you're doing. So nutrition is very important for them. Also for all of us, for prevention. In general, what are the basic guidelines of nutrition? And I've learned a lot in my clinical experience with nutrition, and some of this is controversial, because in nutrition, you know, the more books that we read, the more confusing it is. Is it a ketogenic diet? Is it a paleo diet? Is it a vegetarian diet? Is it a vegan diet? Or a Hope for Cancer diet? What I come to the conclusion is that we should have a diet mainly based on the garden, natural foods, right? The closer we are to natural foods, the healthier we are. There's basically, in my opinion, there's 3 no-nos in cancer nutrition. One is no dairy, because the dairies, you know, cause a lot of mucus and maybe some immune reactions, immune intolerance. So no dairy, gluten-free, because many patients that we studied have gut dysfunction. And the third one is no processed or refined sugar, because that's just feeding the cancer cell. So if we remember these 3, no dairy, gluten-free, and no processed or refined sugars, then we're doing a lot to help ourselves and those patients with cancer. Keep the food the way it was made by the divine, by the creator, right? And so those sugars are healthy for us and will protect us. There was a study done that it studied colon cancer. And what the study showed that if you eat 1 banana a day, the banana that's ripe, you know, with the dots, right? Not a green banana, ripe banana, it decreased the incidence of colon cancer by 40%. So imagine that. 1 banana a day, so it's good to become a monkey, right? So you can eat a banana a day and it will decrease the incidence of colon cancer by 40%.
Wow, it's impressive.
It's impressive. So this is why when they said, oh, don't eat bananas because they have too much sugar, that sugar is not going to feed the cancer cell. So always you have to keep your vegetables like 80% and 20% fruits, right? And have that balance, because fruits, as you know, has a lot of nutrients that the body needs also, potassium, calcium, micronutrients, so many ingredients that the body needs also. Make sure you're chewing your food well, always chew your food well. I like it in Japan because with the use of the chopstick, it takes longer to put, but when in the Western culture, when they use the fork and the knives, they just shove the food in, right? And so they don't chew as much as they should. So chewing your food at least 10 to 20 times is ideal. Also, some patients are very sick when they come to Hope for Cancer. Maybe they had a lot of chemo or radiation, and they don't have taste in their mouth, so they don't have a good appetite. Those patients, we need to give them nutrition through the IV. And that's when we use a lot of good nutrients, some carbs, some fats, proteins, amino acids, vitamins, minerals through the intravenous. But you know, we're not made to eat through the vein. We're made to eat through the mouth, right? So temporarily, we can support nutrition through the vein.
How about juicing?
Juicing is the best way to detoxify the blood, right? And so juicing is very important. I recommend patients to make their juice in the morning, keep it in a very tight sealed container in the refrigerator, and finish that during the day. And maybe 5 to 8 glasses a day. And there's no, you have to juice this or juice that, just juice. You know, vegetables 80%, 20% fruits, and every day it's a better way to detox the blood, keep the digestive system going. And for example, carrots. that's another question, right? Because some people say, oh, carrots have too much sugar. But in the Gerson diet, the Max Gerson diet, he juiced like 4 times or 5 times carrots a day. And so that's a natural sugar that's not going to feed the cancer cell. So for me, when I have carrot juice, it keeps my bowels regular, right? Because we all should be having 1 to 2 bowel movements a day. And I think nowadays, if someone goes to the doctor and they tell the doctor, I had 1 bowel movement every 3 days or 2 a week, the doctor says, great, but that's not good. We need to have 1 to 2 a day. And the carrot juice and the juicing helps keep the bowels more regular because the body needs different nutrients, right? And typically, the brighter the color in the food, the more nutrient rich it is. For example, a red pepper will have more nutrition than a green pepper, right? Even like with potatoes, a red or purple potato will have more nutrition than a white potato. Salads like lettuce, a romaine lettuce will have more nutrition than an iceberg lettuce. Right? So always look for vibrant color. Really high color foods have a lot more nutrients.
So color is important.
Color is important. And you know, if we could eat with the rainbow, right? Different color vegetables and fruits, better.
How about supplementation? Supplements.
Supplements is very important because nowadays the soil where the food grows is not as rich in elements and nutrients as it was 20, 30, 40 years ago, unfortunately. You know, we've contaminated the planet, the air, the water, a lot of pesticides, and all this is growing throughout the planet. So we need to supplement. I supplement every day, sometimes 7, 8, 9 different supplements. But I also rotate them every 3 to 4 months. As we rotate our food diet, we should rotate our supplement. Always you should have a green drink, a green powder, maybe barley grass is one of my favorites. It's very rich in nutrients for detoxing, for giving us all the minerals that we need. It makes our blood thinner so that the blood doesn't clot together. And then we have more oxygen in our systems, in our cells, in our tissues, and organs. So barley grass is very important to supplement every day. Right? Other things that everybody needs nowadays is omega 3, 6, and 9, right? The fatty acids, because we're not getting enough of them in our nutrients, and it's very good for brain health. Right? The brain has a lot of fat, healthy fat, of course. So yes, Hideo, supplementation is key. I recommend anyone that's watching this to go with their doctor or you know, with your group here in Japan to supplement. It's very important because we're just not, even if we eat organic and healthy, we're just not getting enough of the nutrients that we need.